Hello, everyone. Hope you're all well today. Now, thank you for joining me today in our live session. Today's session is on depression in dads. Now, before we start, for those of you who don't know me, I'm Anjali, a childbirth and lactation educator, a hypnobirthing instructor, and a yoga instructor. Currently, I'm a PhD researcher on the topic of mental well being in the UK. Now, over the last few years, perinatal mental health has started getting attention of the public. Now, perinatal mental health refers to mental health in the period spanning pregnancy, childbirth, and the first postnatal year. Now, let me see how many of you have joined in as of now. Great. So, now, amongst those of you who are watching till we wait for others to join, are you aware of anyone who you know or yourself who suffered with perinatal depression, mother or father, irrespective of gender? Do you know someone who suffered from perinatal depression? I look forward to your answers. For those of you who have just joined in, I just asked a question to everyone that if you're aware of someone who you know who suffered from depression during pregnancy or after, mother or father. And okay, so let's move on then. Okay, so I have one yes. Anyone else? Now, do you know the do you know the causes of perinatal depression? Now, postpartum depression or antenatal depression is a commonly thrown around word, but do you know of any specific cause that actually relates to this? These are just a few questions to get us started, get our minds thinking as I move on with the session. So, yes, I do have an answer. Okay, so I'm assuming that's a yes to someone that you know who's aware that had perinatal depression. So thank you for those of you who are answering. Now, moving on to the causes. Now, there is no single cause why men and women develop mental health difficulties during this period, but there are few common contributing factors, and they are uncertainty about parenthood, physical complications during pregnancy, traumatic birth, feelings of disappointment if parenthood is not, what you expected, changes in your relationships, marital or family, changes in your social life, lack of sleep, lack of support from friends, lack of support from family, or significant stressful events like a loss of job, a sudden physical illness. Now these are common factors that can contribute to mental health difficulties during pregnancy and after. Also, you need to remember this is a big life change for both the parents involved, and it is bound to have a bit of an effect on the relationship as well. Now, there has been an increase in awareness and acceptance of perinatal mental health among mothers. So, reported rates of postpartum depression among mothers are increasing, which means that more mothers are now open to seeking help. I've heard many say that, it's higher now and it wasn't there before. That's not true. It may be higher now, maybe, it is increased, but it was always present. What has changed is that reporting has increased because moms are seeking help. And even now, we still have a long way to go, but at least there is a visible change in that area. Now, like when looking at perinatal mental health, one person that gets completely ignored in common conversation is the father. And that's why today's discussion is completely on perinatal depression among fathers. Unfortunately, completely goes undiagnosed. Now, the reason why perinatal depression among dads go undiagnosed are, there are many reasons, but two main ones is one is lack of awareness. So people don't know that fathers also can go through perinatal depression. And secondly, there is lack of mental health screening. So at hospitals, at primary care providers, not many people actually screen for the father's mental health. Now, just another question before we move on. Do you know how common perinatal depression is among fathers? So, if let's say you have, what percentage of fathers have it? You, just make a random guess. I would like to know how common you think it is, and then I'll tell you how common it actually is. If you don't know exact, that's completely fine. Just a random guess would do. I look forward to your answers to that before we move on now. I've heard a lot of numbers, but since we are having this discussion, I definitely want to know what you. No guesses at all? Okay. Okay, we have 140%. Any more? Anyone else willing to guess? Okay. So the actual number is 1 in 10 dads. So 10%. 1 in 10 dads will become depressed when their partner is pregnant. And this is based on research that's done across the world in every population. On average, 1 in 10 fathers do suffer from perinatal depression. And this 10% is even far higher when you look at fathers under the age of 25. So there's a very clear difference in increase in perinatal depression if the father's age is below 25. And as a father, you may be at increased risk if you have experienced previous mental health difficulties, or if someone in your family has had mental health difficulties during pregnancy or after giving birth. So, familial risk is also a factor. Or even suppose previous, few years back, you had issues with anxiety and depression and you've recovered, you will still be at an increased risk if you have experienced previous difficulties. Another interesting thing is first time dads are particularly vulnerable to postnatal depression. So, depression after the baby is born. And alarmingly, the number of men who become depressed in the first year after becoming a dad is double that of the general population. So, your chances are exactly double. And one thing to remember is that the peak time for postnatal depression in men is 3 to 6 months after birth. So most it if you are about to if your partner or you are getting postnatal depression, then the peak time for men is between 3 and 6 months after birth. And this also has an influence from a couple basis. So, if one of you is experiencing emotional or mental health difficulties, it's more likely that the other one is as well. So, if a mother has postnatal depression, the father has almost 50% chances to experience postnatal depression himself as well. So, that is how common perinatal depression among fathers is. And now that you know how common it is, let's look at how to identify it, because that is the most important part. We may know how common it is, but if we can't identify it in our loved ones, then we can't do anything about it. And so, before I list out the symptoms, can you think and tell me what could be possible symptoms of postnatal depression among fathers? So, anything that you can think of, if you imagine that a father has postnatal depression or perinatal depression, what do you think could be a few of the symptoms? Now, symptoms can be physical, emotional, cognitive, or behavioral, and I'll take you through each of the symptoms or each of the types of symptoms one by one. But then I just wanted to know if, just to test about how much you know about this, or what do you think are the ways to identify depression? Okay, so I'll start with the physical signs first. Now, common physical signs that a father is going through perinatal depression can include tiredness, lack of appetite, so you don't feel like eating at all, diarrhea, indigestion, trouble sleeping, or sleeping and waking at very unusual times, sudden weight loss or weight gain. Now, all of these six are very common physical signs that show up in fathers with perinatal depression. And if you look at it, these signs are where, it's pretty common. But if you see them in perspective of the timing and along with other emotional symptoms, then you might consider talking to someone about it. So, just to recap, physical signs might include tiredness, a lack of appetite, diarrhea, indigestion, trouble sleeping or sleeping and waking at completely unusual times, and weight loss or weight gain. All of these are very common physical signs. Now, looking at emotional signs, then you might feel very sad. A father might feel very sad. A father might suddenly feel very guilty or ashamed for no reason. Father might be very cranky, anxious, or angry. There's a lot of anger that can come out. You might feel isolated or disconnected from your partner, friends, or family. You might feel like everyone else is completely disconnected away from you, the people living in your house, your friends. You don't want to talk to anyone. Also, one of the most common signs of any form of depression is that you're unable to enjoy things that you used to find fun or pleasurable. So if there was one hobby, or for example, let's take cooking. If you used to find that very fun to do and enjoy, and all of a sudden you're not able to enjoy things that you used to really find fun, that is a very, very typical sign of depression among anyone, and especially in perinatal depression as well. And you might, that is your emotion and mood. Now, you might also have changes in thinking, and this is slightly different because when you talk about depression, people usually do link it to feeling upset and angry and anxious. But another also very important point is that your thinking process might change. So you might suddenly be unable to concentrate on something, or you're not able to remember things that you always do. You're having trouble making decisions or doing just normal everyday tasks. You might have thoughts of being overwhelmed. You're feeling out of control and you can't cope. Now, these are changes in thinking that could be a symptom of perinatal depression. And you might also think about suicide or death, which is very dangerous. And if it actually does come to that stage, you do need to contact a doctor immediately. Changes in behavior, like substance abuse is very common among fathers who suffer from perinatal depression. And by substance abuse, I mean sudden usage of drugs or increase in usage of alcohol as a way of handling your emotions, because you feel you're not able to cope. A lot of fathers go into substance abuse, and that is again a very, very clear symptom of perinatal depression. You might withdraw from family. You may, suddenly there's a change in behavior where you want to spend more time at work and not at home. That is again a change in behavior that is noticed during perinatal mental health issues. And just I'm going to take a break here and just look at the questions and that you posted so that I can keep in touch. So, how can fathers identify the symptoms? Yes, so the symptoms that I just spoke about, so the physical, emotional, thinking, and behavioral symptoms. Now, all of these four can be identified by the father himself, or by the partner, or by a friend. Sometimes it's a third person who sees it, who does not belong to that family, who suddenly notices changes. And yes, indifference and irritability does come into these as well. And does the father feel uninvolved with the baby? Yes. That is a very typical symptom of postnatal depression amongst dads and moms as well, where you don't feel connected to the child. You feel very disconnected, and you find it very difficult. And yes, that is a sign of postnatal depression. And so now we looked at how common postnatal depression is. So we know it's on average 1 in 10 fathers who suffer from postnatal or perinatal depression. And now we also saw the physical, emotional, behavioral symptoms that a father might show that, as that he has perinatal depression. Now, one of the main reasons why this topic is so important is because perinatal depression among mothers and fathers can have short and long term effects on the child. There is a lot of research that has gone into how depression in the parents affect the growth of the baby. And today I'm going to highlight on the depression, on perinatal depression, on dad's effect on the baby. So, for starters, it affects the relationship with the mother. That is a given. If a father is going through perinatal depression, it's highly possible the mother is also going through perinatal depression, and their relationship does get affected. But when it comes to the father, to the child, a dad's depression is associated with emotional, social, and behavioral problems in the child, also leading to developmental delays in some aspects. So, there are few very clearly researched and studied established effects that a father's perinatal depression can have on the child. And some of them are firstly, high level of emotional or behavioral problems in the child at age around 3.5, and at 7 years. And this is especially pronounced in boy child. So there is it's we're not able the research hasn't really established why boy babies get more affected than girl babies when it comes to father's depression, but it is established that there is a link. So these children struggle with emotional resilience. They are also they have high levels of fussiness. So children of fathers with perinatal depression have higher level of infant fussiness, and they cry a lot. So one of the common effects of perinatal depression is that the infants are known to cry a lot. They can be colicky, and they are far more fussy than other babies. And another important effect is that it leads to problems in children's peer relationships. Again, this is long term research done, and it shows that as the child grows up, it struggles with making peer relationships and friends in schools and so on. So that's another long term effect. Another indirect effect is that when both parents are depressed, they are least likely to follow the good health guidelines. For example, breastfeeding for the accurate amount of time, or taking children for their infants for vaccinations on time, putting them to sleep on their back. So there are a lot of good health guidelines which parents with depression are not as likely to follow, which then has an indirect effect on the child. Then depressed fathers are less likely to read, sing songs, or tell stories to the babies and other than fathers who are not depressed. And this affects the bonding that happens between the child and the father, because playtime is usually related. You sing songs to the baby, you play with the baby, and depressed fathers do not want to do it. So indirectly, it affects the bonding that the father has with the child. Then another interesting research was that depressed fathers use a flatter tone of voice when you interact with babies, and this has been linked with cognitive delay in the infants. So, because the father's emotional state leads to a flatter tone of voice interaction, and that's not picked up by the kids as much. Now, those were some of the highly, evident effects of perinatal depression on fathers on babies, and these are all established effects. There are a lot many more which does not have strong evidence base yet, but these are the ones that are definitely established. Now, all of these risks that we spoke about, the association is much stronger when a father has antenatal and postnatal depressions, so which means the entire perinatal period, and especially if the symptoms are much more severe. Now, and the risk definitely goes much higher if the mother also has had issues. When research was conducted on positive mental health and transitioning into parenthood, it was found that most fathers wanted to be included in all aspects of pregnancy. They felt that once they were armed with the knowledge and the expectations of this period, they were much more secure in their ability to deal with the transition into fatherhood. And so it's very important that the healthcare providers and as mothers, you involve your partners into the aspect of pregnancy and childbirth. Now, further research found that the engagement of fathers in the care of mother and unborn child during the antenatal period. So, if the fathers were involved in the pregnancy throughout during the pregnancy, fathers have a positive mental health outcome because of that involvement. They know what's happening. They are far more up to date on how the mother's feeling and what to do, and communication, which is the most important thing. Now, due to lack of awareness, fathers who experience psychological distress in the perinatal period, they tend to question the legitimacy of their experiences. Now, fathers are reluctant to express their need for support or to seek help because they feel that just seeking help means the attention from the partner is detracted, whereas, the partner is the one who's pregnant. But that's not the right way to think. You're a couple and you're going through pregnancy and parenthood together. So if you are facing psychological distress, you do need to seek help, and there's nothing wrong with that. And you are doing a benefit to the child and to the mother if you're open about it and you talk about it. Now that all of you listening are armed with this information, you know that it is common. You know 1 in 10 dads suffer from psychological distress. You know there are many, many symptoms, and you can identify post perinatal depression among fathers. It's important to tell the other men in your life who are going through this phase that it is normal, and support them to get the help that they require. It could be, it could be a cousin, it could be a friend, it could be your partner, it could be your brother, it could be anyone. But it's important to tell them that it is okay, and you should seek out help for this. Now, ask ask the men how are they feeling, if you know they're in the perinatal period. Very rarely do people actually genuinely ask how someone's feeling about the whole transition and the whole change. Communication between partners, between the spouses, between family members is very, very important, so that all of us, we strive towards achieving positive mental health outcomes for both the mother and for the father. So, in summary, that I hope the session was helpful, and I try to keep it as concise and to the point. And if you have any questions, please post them in the comments, and I'll answer them. So, yep. Thank you so much. I'll stay on live for a few more minutes in case anyone has any questions. Now, if anyone's interested and if you would like to put a message, I can do a similar session on postnatal depression for mothers as well, where we go through details on symptoms, how to identify when it strikes, and where to get help, how to get help, and the risks for the baby and in infancy and childhood as well. So this was completely based on fathers. I can do a similar one for mothers as well if anyone's interested in that. Any questions? I'm just checking the comments to see if I missed any. I think there are no questions right now, but I will save this video. It will be on the Sahodri page, so you can access this video anytime you wish. And if you go back, think about it, you want some more doubts, you want something to be cleared, just post it on the same video, and I'll get back to you for sure on that. Thank you so much. Have a great weekend. It was great having you all for the live session. Thank you.